Hello, everybody. My name is Allison Fliehman, and today I'll be presenting on irritable bowel syndrome, most commonly known as IBS. My goal of this presentation is that you will gain an overall experience of what IBS is. You will be able to list treatment options for someone that has IBS. You will be able to identify the health risks for an untreated person with IBS. And you will be able to explain the different program implications for someone that has IBS. So, what exactly is IBS? Irritable bowel syndrome is a problem that affects the large intestine. It can cause abdominal cramping, gas, pain in the belly, and a change in bowel habits. Some people with the disorder have constipation, while others may have diarrhea. Some people may go back and forth between the two. It does cause a great deal of discomfort in people that do have IBS. IBS can be treated, but sadly, it is not a curable disease. But it can usually be managed by daily habits, like diet, lifestyle, and stress levels. But sometimes with more severe symptoms, people need to be treated with medication or counseling. In the United States, we see that IBS affects 25 to 45 million people. We see that twice as many women than men have IBS. About 2 in 3 IBS sufferers are female, and about 1 in 3 IBS sufferers are male. We see the difference in these rates between men and women, partly because of differences in health-seeking behavior and as well as differences in willingness to make or accept that diagnosis. Women are more likely to go to a doctor or to a health professional to seek treatment or see if they have any issues when they have symptoms of IBS. IBS does affect people of all ages, including children and elderly, but we see most of the diagnosis made between people that are 25 to 45 years of age. We still don't know the exact cause of IBS, but the impact that it can have on a person can range from mild, moderate, to severe. People with moderate to severe IBS really struggle with symptoms that often impair their physical, emotional, and social well-being. Stress can affect IBS, but it is not the cause of IBS. It can trigger the onset of symptoms for many people. Treatments are available to help manage IBS that has to be diagnosed by a medical professional. Not all treatments work for all people. Through research, better treatments can be found. IBS is common in the general population, but a lot of people don't even seek medical care. Nearly 2,000 patients with IBS reported in a survey that their diagnosis of IBS was typically made 6.5 years after the symptoms began. Long-term symptoms of IBS can disrupt someone's personal and professional activities. This limits their individual potential. Some of the physical health complications of someone that has IBS that's left untreated could be fecal impaction, hemorrhoids, malnourishment, and rectal prolapse. Some of the mental health complications that someone may have when they have IBS that is untreated, they can have a fear of going into public places, especially ones that are unfamiliar to them, due to concerns of there being a bathroom that they can get to quick enough, being able to find one at all. This can withdraw them from their friends and their family and their coworkers. It's making their life less enjoyable, less easy to go out and do the things that they would like to do. This anxiety can also cause not only gastrointestinal issues, but other chronic diseases as well, such as heart disease or respiratory issues. Genetics can play a role in the development of IBS. And there are certain foods that trigger symptoms. Some people have intolerances to certain foods, and some people have allergies to other foods. It does vary person to person. And it does go back and forth between diarrhea or constipation and what foods cause those issues. Psychosocial factors can trigger IBS. There are traumatic events that can happen to people, say physical, emotional, or sexual abuse. That can be a risk factor and can affect the onset of IBS and how severe it can be later in life. After you have been diagnosed with IBS, your doctor may give you some tips on what foods to eat and what foods to avoid, or they may even refer you to a dietitian. Some of the changes in your diet that might help is to eat more fiber and to avoid gluten and to follow a special diet called FODMAP diet. FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, which are a short chain of carbohydrates and sugar alcohols that are poorly absorbed by the body. This is the result that you have in IBS with abdominal pain and bloating. FODMAPs can occur in foods naturally or as additives. Medications are sometimes needed for someone that has moderate to severe case of IBS. There are two types of IBS, IBS with diarrhea and IBS with constipation. There are certain medications for each of those. There is also some psychiatric treatment that can be beneficial to someone that has IBS. A lot of IBS patients who seek medical care suffer from anxiety or depression, and they benefit from cognitive behavioral therapy, hypnotherapy, and dynamic psychotherapy. One of the greatest changes that someone can make in their battle with IBS is self-management. Being able to change their lifestyle habits to make themselves more comfortable. They find their own diet that works best for them and benefits them and their IBS, which leads me to a diet program. Maybe something offered by a local health department, not only for the education of a certain diet plan or what they should and shouldn't eat, but they also have a support group around them of people that can relate to them, and they can talk and see what works best for each other. I also believe that counseling can help with living with long-term abdominal pain from IBS. That can lead to anxiety over their symptoms. It can lead to depression, or feelings of hopelessness can set in. And in addition, depression can cause other symptoms like lack of motivation and withdrawing from their friends and family. So counseling can help with mental health complications of IBS as well. Some concerns for the programming would be location. When and where would these programs or classes be taking place? And is it accessible for everyone in that community? With transportation, are these organizations going to be providing transportation to and from the program? Are people going to have to provide their own transportation? How will this impact the community? Will the community be involved in these programs for IBS? Will people benefit from these programs involving IBS treatments? The most important thing is that, everyone is affected in a positive way, and that we reach people that, need this help with counseling and with diet and with self-management and being able to educate them. Thank you for taking the time to watch this presentation on irritable bowel syndrome. If you have any questions, comments, or concerns, feel free to contact me. Hope you all have a great rest of your semester.